Hi, welcome to Sidewalk Talk. I'm Steve Fortunato. 2020, well, and it's an understatement to say 2020 has been unique, but there's one thing we all have in common in the world, and that is dealing with the COVID situation. And there has been a lot of mental challenges. And I am welcoming to this podcast a mental health professional, Dr. Chanel Young Pope. She's a doctor of clinical psychology. She's a resilience professional, a wellness consultant. She's the founder and CEO of Sapiente Wellness. And there she enriches the quality of lives for business professionals in particular. She deals with a lot with burnout prevention, burnout intervention. Doc, thanks for joining us.
Good morning, Steve. How are you?
We're doing okay considering, right? It's 2020. Everyone keeps saying the same thing. Well, what else can happen? It's 2020, right? So I think we've all adjusted in this world to expecting the unexpected, haven't we?
Absolutely. And it's almost some people are a little scared to ask that question, what else can happen? But I'm optimistic despite all this happening. I came up with a little mantra, I'm prospering in a pandemic. And so you just have to stay positive.
Well, Doc, let's get to it then. How do we do that? How do what kinds of let's start with a little bit of advice and then get into details about what you do for business professionals. We can it's I can say, hey, stay positive, go get them. But realistically, there is a lot of anxiety people are dealing with. I mean, we don't need to go through all the different things. We know people are dealing with a lot right now, and some are doing okay, but I think a lot of people are not. How what are some of the things that you recommend people do?
Well, I think the bottom line up front is really to look at and focus on, what are the top things that are stressors right now in our own interpersonal lives. As professionals and leaders, many of us have, been trained to be workaholics, and so my focus is really helping people to kind of hone in on stop, take a breath, what key things are impacting you right now, because most of us that are effective leaders, I'm thinking first responders and entrepreneurs like yourself, we have to just get it done. And so many of us are just going, and we don't take the time to actually say, okay, hold on. Self-care is the major thing. Despite all the stressors, we've heard it time and time again, just like on the airplane, when they say, hey, before you can assist your buddy, you have to take this oxygen mask and put it onto your own face, right? And so, really just stopping to pause to assess what is the most troubling area of my life right now, and then looking at coping strategies on how to more effectively manage that. Because many of us don't stop running until some crisis happens, we get physically sick. Um, you know, I'm thinking of people, who've had cardiac arrest. Many of them were just going until they had that crisis event. So taking the time to really manage self-care and to be okay with acknowledging that something's not going perfectly, you know?
Well, we had a sleep expert on recently, and one of the things that stood out to me is she was saying you need to prioritize your sleep, and I feel like you're saying the same thing about your wellness and your mental wellness. So yeah, she said just like have to take care of whatever, take care of the kids. It's a priority to get the work done. It's a priority. We have all these priorities, and we don't even list sleep. And so just put it on your list as one of the things that you need to do. Is that the direction you're going? Is that what you're thinking? You need to prioritize.
Absolutely. I agree with what the sleep expert said, is because realistically, no sleep. I was reading something the other day, and it was like a quote, and it said, entrepreneurs and leaders, because it was information about, financial success. You sleep when you die. Sleep is for broke people. But the reality is, if you don't sleep, you don't give yourself time to rejuvenate cells in the body. So in along the same vein, in terms of our emotional wellness, is something that we have to prioritize and not allow it to be managed through crisis, if that makes sense.
So
And so
don't wait for the problem. Don't wait for the catastrophe. Be proactive. So, and you deal a lot with entrepreneurs or businesses, and they help out their executives, or or maybe it's nurses. I mean, you talk about mental well-being and dealing with seeing a lot of things. Those people in the emergency services industry. So, but how does someone prioritize that? What do they write? I can do this mental health, but what do they do? How do they go about doing something like this?
So to do that, here's one of the exercises that I do with professionals that I see routinely. There is a work-life balance wheel, and it looks like a sort of like a pie. And each area of that pie is represented by finances, spirituality, family, work, professional, professional ventures. The pie chart is completely filled, right, with about 7 different areas. And what I ask the person to do is, on a scale from 1 to 10, 10 being I'm stressed out, I have no idea how I'm going to manage this, I'm almost at my breaking point, and 1 being little to no stress. You take those top 3 areas and rate them. Actually, you're rating all 7 to 8 areas, and you're going to rate them. And so the highest top 3 that are, or the highest ranking top 3, are the ones that I'm going to challenge the person or the company that I'm working with. Say if it's a CEO or a group of individuals, right? Because I also do group coaching. I'm going to challenge them to rate that, and those are the top 3 things that we're going to work on and manage. Because sometimes it's so much going on, we get so overwhelmed that it's hard to figure out what the root of the stress is, because I may have 3 stressors going on. When I was in the military as a trauma professional, I was working with service members who were maybe in a unit where they were having conflict with their supervisor. They had marital problems. They also had financial problems. Oh, and by the way, they were getting ready to get deployed, and their wife may have been pregnant. And so it's like, it's a litany of things, and it's different for each individual based on the actual profession that they're in. And so really helping the person kind of dumb down, okay, so this is the root of what I'm dealing with now. I can't manage everything simultaneously. So I'm going to focus on these 3 areas, and then we'll go from there. And as you know, I call it spillage. There's emotional spillage. So if I'm stressed at work and I'm consistently hard charging for months on end, then that may roll over to me being irritable with my wife and kids. And so that spills over into marital strain or being an absentee parent. And so all of those things are kind of interconnected. And so I work with individuals on narrowing it down, focusing on what your key areas of focus need to be to help you decrease stressors and be the resilient professional that you were designed to be. And so my primary focus is professional resilience, but helping the individual to see how to effectively manage work-life balance, fatigue, burnout, and all those kind of little negative things that come at us to sabotage our overall energy, if you will.
You're saying be proactive, not reactive.
Absolutely, but that is, as we say sometimes, is easier said than done.
Yep.
Because as you know, when we're irritable and stressed out, for the most part, we're not gentle, kind
Mm.
people. And so, yes, be proactive on the front end, before a crisis happens. You get physically ill because of, you know, thinking, like you mentioned earlier, oh, don't you, we don't even prioritize sleep. It's like, well, you know, there's 24 hours in a day and I'm going to work 22 of them and get 3 hours of sleep. Well, long term, how productive are we really? Um, and so that was kind of the dynamic that brought me into this work, kind of seeing the creme de la creme, people in the United States military who are, you know, innovative, very highly well trained, some of the most brilliant, highly educated individuals struggling in those areas to manage it all, and seeing their exterior, their physical continence change because of stress. And I was one of those individuals. It wasn't like I was looking at everyone else going, you need to get it together. I came into this work because I actually experienced fatigue, burnout, and had a physical illness as a result of it.
There's a lot there. And I want to, first of all, 24-year military vet, thank you for your service. We appreciate you very much.
You're welcome, Steve. Thank you for acknowledging
Of
that.
course. Of course. So did you identify, it's a real cool story. You're doing this based on your own experiences. And then is it, did you identify that you wanted, did this happen when you, when you were in the military, that you identified this people need help, I can help them first, I need help? Tell me how this all came about then.
So it was I was stationed at my last 3 years in the military. So I'm a what they call dual component service member. So I did 10 years in the United States Air Force, but I was a reservist, had some stints on active duty. And then I got commissioned in the United States Army, and I did 14 years in the Army. And so my last duty station was in Fort Hood, Texas. And so it was, you know, we've heard the news reports about Fort Hood. And so there's been some traumatic events that have taken place there, you know, recently and within the last, you know, 5 to 10 years. And so I was a trauma professional working in a behavioral health clinic. And so it was very, very fast paced. So my days were anywhere from, you know, a 12 to 14-hour day. By the time I went to work, manage all the administrative duties that I need to take care of in terms of paperwork, you know, additional meetings and that kind of stuff. And so back to sleep. I was probably averaging maybe 4 hours of sleep a day because I worked shift work for years before coming into the military while I was in college. And so sleep was always a problem. And then having an extreme caseload of, as I mentioned before, treating and caring for individuals with complex issues, I began to experience what in the mental health and medical field is called vicarious trauma. And so as a result of that, I started experiencing a chronic pain syndrome. And so I was diagnosed with a chronic pain disorder. And so that was my sort of interpersonal story. But I was also working on an interdisciplinary team with medical professionals to include MD, medical doctors who were psychiatrists, worked with nurse practitioners, social workers, mental health technicians. The military has the combat medic, and so those were the people that were on my team. Very, very fast-paced culture, and I'm working with the top clinical professionals. And I remember sitting in a meeting one morning. It was an interdisciplinary meeting we would have every morning to talk about, you know, what patients had to go to the emergency department, and just kind of relaying statistics that had happened within the past 24 hours. And I looked around the room, and I remember just seeing I remember one of my colleagues in particular, she had an oxygen tube, and so she was at our table literally with an oxygen tank. And so I just remember looking around, seeing people looking very, very tired. Some of them, because they were colleagues, but also personal friends, we had rapport. And so they would talk about their aches and pains. They would talk about their frustration with, some of the bureaucracy that mental health professionals have to deal with in terms of response time to patients and intervention and that kind of thing. And it dawned on me, we're the creme de la creme, if you will. And this is if it looked like a motley crew because we were all tired and overwhelmed and, but still invested in doing what we needed to do to care for patients. And so my focus shifted on, I wonder what would be a good way to help professionals, not just in the medical field, but professionals from all disciplines all across the world. What would be a good way to assist them with managing stress and fatigue and boosting resilience so that they can be the best version of their professional selves? And so that's what made me want to come up with a web-based e-course around resilience, burnout, fatigue, work-life balance, sleep, and all those other things that you don't have to be a doctor, to manage that. If you're an entrepreneur like yourself, or a nurse, or a caregiver, that's a huge population that is constantly experiencing overwhelm. And so wanting to streamline that in a way to help others, as well as tweaking myself to be a better version of myself, is how I decided, okay, I want to launch Sapiente Wellness and get into the nitty gritty of improving myself, but also helping others as we do that.
That's an interesting story. So what you're saying is the mental health professionals, I mean, as mental health professionals, you weren't even practicing what you're preaching now. And you're like, so you discovered it with your own people. You guys weren't even able to take care of yourselves. All people need something like this at some point, probably, especially, in 2020. So you discover that, you figure, you say, so when you were in the military, is that when you said, I assume you said, well, I got to fix myself first. So you kind of self-diagnosed, and then you went and you figured, so you're saying you fix yourself. Did you say right there though, I need to do something about this for everybody? Did you know there that eventually you're going to get to, I'm going to fix myself and then I'm going to start this practice, or did that just happen?
It kind of happened. I have to be honest with you, Steve. No, I did not fix myself. I think that is possibly a myth. There are some folks who are excellent at self-care. Those are, some of your nutritionists and your yoga instructors,
Hmm.
and the physical exterior, they are excellent at managing, right? But a lot of us, because we don't see, you can't, necessarily just look at someone and fully assess, the if they were to get a score for their mental health, right? We can see the exterior. Like if there's a cancer patient, we can see, oh, okay, they're going through chemo, and so there's some residual physical symptoms as a result of that. But no, I did not get the memo until, as I mentioned before, there was a crisis. Like
Yeah.
it didn't dawn on me that I was stressed out. I remember being at work and my sciatic nerve gave me a clue that something was wrong, and I was at work. I hadn't eaten breakfast, so it was the norm to just come. The military trains us to work, 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 work. You work until the work is done, and the truth of the matter is the work is never done. And so I was at work and I got this cramping sensation. It went from my tailbone to down my groin, and I couldn't walk. And so I was scheduled to see patients that day. And basically, I had to cancel and go straight to the ER. And so that was, and I believe I got bed rest and a bunch of pain meds, but it didn't click that I wasn't managing the emotional health, because the body is connected,
Yeah.
mind, body, spirit. So the emotional piece, and because I didn't have an outlet, or um, I didn't choose to effectively utilize the resources that were there for me. And so the physiological symptoms began to manifest. And then I had the aha moment, which was what I was saying before. We normally don't respond until we have a crisis, either physically or a family crisis or a financial crisis. And we don't really respond until a crisis alerts us. And then we go, aha, I have a problem. So it was then that I realized, oh my goodness, I'm falling apart. And so it was really a moment for me to go, yeah, I really need to practice what I preach. And so I then they say in my line of work, every counselor has a good counselor. And so I began to do the self-help part with seeking professional counseling around managing a toxic work environment. And so it proved to be effective for me. But I, having, education and all that stuff, the reality was I didn't do anything to execute until my body said, Chanel, I'm tired and I'm going to let you know. You're going to sit down because the sciatic nerve is on overtime. And trust me, if anyone has had sciatic nerve pain, they know it takes you
Yeah,
out.
I get that. I get that. And but you hit something earlier, whether it's a CEO or a caregiver or somebody in the military or a nurse, whatever it is, they're they're valuable because a lot of it's their thought process. I'm going to continue to go until I get the job done. And reality is the job's never done. That really sticks with me because that's true, right? At least in up here, we think it's just never done. So we're
Steve, my
always
sound went out for a second.
oh,
Repeat that statement again.
so it when you had said, um, I think you were talking about the armed forces. When you're armed forces, it's you continue to go until you get the job done. But reality is the job is never done. For a lot of us, you may not be working with whatever. If you are a CEO, you might not be working with the team or staff or a client or whatever it is, or the board of directors. Maybe you're going to bed, you're going to sleep, but you don't turn it off. In other words, the job is really never done. It really isn't. So, and these people are valuable to the businesses they work with or operate, or to their employees, because they bring it to the table. They
Mm-hmm.
feel the heavy responsibility to take care of and help out the employees, whatever the situation is, or their clients or patients. But how will they know? I get it. There's a crisis. I have a sciatic, extremely painful. I'm done, right? I'm out. Something's wrong. But how do they know before it gets physical? Because mental and physical, spirit, it all connects. But how can they figure it out before they get there? I guess this would be my question.
That's an excellent question. My answer to that would be when they have no peace. The example that you gave about not being able to turn it off, um, I was one of those people. And an exercise that at the time a professional had me do was, she was like, you, you can't have a to-do list with 25 things on it. Well, you can, but it breeds overwhelm. Um, so the reality is you have to give these things a container. And so one of the things she had me start to do was to put no more than maybe 5 things per day on my to-do list. And so back to prioritizing, right? The key thing is those top time sensitive things go to the top of the list. Everything is not a must. Some things are a must, Some things are a probably, and some things are a can do tomorrow. And so after I created that, right, then she advised me that I needed to give it a container. What does that mean? I was like, give it a container. What do you mean? She's like, you work on it until a certain time, and then you have a knockoff time. And anything that I'm that person that's like, oh crap, did I turn the iron off? Oh my God, I forgot to call mom. And so the thoughts are just going, going, going. She's like, you write all the stuff down either in a journal, or I use the note section on my phone.
Yep.
You write it all down before your head hits that pillow, and you command to the universe that it is done. Even God rested, right? It is done until I come back to it. So figuratively, she was saying you're putting it in a imaginary box, if you will. You're placing a container on it until you're ready to open it again tomorrow. So when you said, how does the person manage it before the crisis? It's if you realize that you're anxious or unsettled and you have no peace, there's always this angst, then you're probably on the cusp of overwhelm. And most of us kind of feel that in our gut. Like, when you're revved up, or it's just things are just not settled. And so if we prioritize, like, I can't function without to-do list. I realized that. I was trying to keep it all up here. I just cannot. I have to do a to-do list. I make sure it's not overly, like, there may be one for the month, but it gets broken down into chunks. So chunking the things that are our priorities, and then giving ourselves permission to actually say, this is my stopping point. And I'm not going to feel guilty about it, because Rome was not built in a day. Now I understand that sometimes there are time crunches. If you're submitting a contract or something like that, then you may have to burn the midnight oil. But that is for a condensed amount of time. And when that timeline is over, then you go back to a norm. But if we're constantly day in and day out, always in that angst crunch, it's never ending, and you've been doing it for 10 or 15 years, it's problematic. It means that we need to delegate some things. We need to put some things in containers. And those are the skills. I call it strategic time management, strategic work-life balance. Strategic means you really have to put some thought into strategizing how we can really define what a priority is and what is something that we can, that is not as time sensitive. And so to come back to your original question, how do we know? How do we manage it before this crisis point? Is really, really being attentive to, are we in a place of unrest? Because the body is going to tell us. Like, I remember I had headaches often. This is before physically I had this, incident where I had to go to the ER and whatnot. Headaches, back pain, knee pain. It was from holding all of this stuff in, not having not having an outlet, or I won't say not having one, because there were resources available. I chose not to execute them or implement them. And this is a major issue with many professionals, because they're leaders. They are the go-to person. They are the person that the whole family depends on. They are running the entire medical department. What would they say if anybody knew that I had my own therapist, or I had, to consult with a mental health professional, or I had to go to, Overeaters Anonymous, whatever the case may be, right? We're, as leaders, we're trained that you just suck it up and drive on. You don't need any help. And the problem with that philosophy or that train of thought is eventually there is a timestamp on that before either the crisis comes or our body keeps the score and tells us, hey, I'm checking out today.
The mental becomes physical.
Absolutely. It is connected. And um there are many people who I call them withholders. They are just kind of people that they just hold it all in, and they feel like, that's for weak people. Those resources are for weak people, and they suck it up. But those are the individuals that end up with cancer, end up with cardiac issues, um, all manner of physiological symptoms, because the body wasn't designed to manage long-term stress. And so if we don't manage things on the front end, by George, they come to bite us in the behind on on the back end. And so the other interesting thing, Steve, that I've thought a lot about is when we have a physical issues, let's say cancer, right? And we find out a family member or one of us actually has something like a diagnosis that's significant, we're encouraged. Oh my God, you have cancer. We need to find you the best treatment professionals, in your region. It is heavily encouraged. But if we have a broken leg, right, you're going to find the best doc, who's the best surgeon that can reset that thing, and manage it cosmetically so you don't have a large scar and the leg heals properly. But when it comes to mental health, there is this stigma that prevents business professionals and lay people, for that matter, from going to seek out resources to assist them be a better version of themselves. But when there's a physical illness, we cheer the person on, hey, go get it. But when we manage our mental health, for some reason, it is viewed as if we have a flaw, or we are weak in some way. And so our frontline leaders, first responders, CEOs, those kind of folks, many of them are not the kind of folks who are going to go sit in a therapist's office. So that's also why I wanted to create a web-based product that can assist individuals globally, in a way that they can be transparent about these things without having to feel as if they are flawed or weak in some way. But that they are actually managing resilience and becoming the best version of themselves that they could be.
Yeah, I think the stigma thing on mental health. I feel like it's getting better. I don't have data to say that the stigma is getting. I lost a brother-in-law to suicide, and I saw the pain, and obviously there's a lot of pain in the family.
Sorry to hear
But
that.
yeah, well, thank you. And I witnessed like it made me much more aware of mental health. I always thought, can't people take care of it? And
Absolutely.
my wife and we always compared it to, it's like, once exactly what you said. I mean, cancer. Okay, I mean, I don't know if it's because it's more invisible. Mental health is more invisible, but I'm more aware of it now, and I can see when people are struggling mentally. So to me, it is somewhat physical. You can see it, but um, yeah, if someone is sick, they are sick, and they go take care of. So, and it was like jokes about mental health. It's not like people don't make jokes
Hmm.
about cancer. Why are people,
Right.
but I do feel like it's much more, um, I think people are much more aware that it is a serious issue, and that it can, and then seeking help is a good thing. But I do think the last people that will accept that help are the people you are talking about, which would be those frontline workers. It would be a caregiver, honestly. I mean, the caregiver, if I don't do this, you know, mom's in trouble. I got to be the caregiver, or it's that CEO, or it's the entrepreneur. I think those people are going to be the last to accept it. So, I mean, would you agree with that?
Absolutely. There are kind of mental blocks and barriers to why people, won't go, as you just said. One is everybody says they don't have time. I got too much to do. I don't have time. But as we mentioned before, right? It is about prioritizing what you know will sustain you long term. Your original question a little earlier was, but Chanel, how do we catch this on the front end,
Yeah.
if you will, right? Before there's any crisis, it's just like anything else. In the military, they taught us this term, preventative maintenance. And that term was tied to our equipment, right? We had to clean it, we had to properly stow it. We did, maintenance checks, right? And when we did those maintenance checks, if we could see that, screws were eroded, or, and it wasn't just to physical equipment, it was with paperwork and all those kinds of things. But it's the same concept for us. Like, preventative maintenance is what we have to do on the front end to manage the long term goal of staying physically and emotionally healthy. And um, busyness is one of the key barriers, right? I don't have time, but we won't go months or weeks without eating. You know what I mean? That's a key thing that we have to do to sustain us, right? Is proper nutrition. But when it comes to the management of our emotional health, we'll go years or never, right? and
Yeah.
and some of that also is about culturally, about worldview, and culturally what we've been taught, right? Based on family of origin, based on ethnicity, all of those, and based on economics. There are some people who don't have the financial resources to consistently go see a mental health provider, right? And
Hmm.
then there are folks who just don't believe in it. They just, yeah, that's for weak people,
Yep.
or, that's not a part of who we are. We just don't do that, if you will. And so the busy professionals and smart people, we have, I look at Facebook and Instagram, there's a subject matter expert on every timeline, right?
Hmm.
And everybody's a guru now. Many of them don't have degrees. Not to say that you're not smart if you don't have a degree,
I got
but
you.
many of them are self-proclaimed experts,
Mm.
And so some people are like, I'll just study it. I'll just read up on it. And so kind of faulty thinking around why it is important and how they can benefit from it. Another barrier is some people have attempted and had horrible experiences, where they've gone to see a professional, or maybe even it's not even a mental health professional, but maybe a life coach, or some person who was a subject matter expert, if you will, or proclaimed to be, and it wasn't a good experience for them. And so they throw the baby out with the bathwater. And so I talk about coaching and counseling. I use the analogy that it's like trying on a good shoe, right? When you go for running shoes, you have to try on 3 or 4 sometimes before you find the one that really, really fits. And so it is with wellness and life coaching, and this idea of you have to find what fits for you and pull those strategies in, because the wellness regimen for a nurse, may be a little bit different than an entrepreneur or a medical doctor that's, managing 6 very large, fast-paced practices across a metropolitan region or area. You know what I mean? Or wellness for a new mom
Hmm.
may be very different than maybe wellness for a single dad.
Yeah.
And so it has to be designed and structured in a comprehensive way based on the wellness professional that you're trying to assist. And so that's my approach and strategy, because everybody, not everybody, but a lot of companies use the word wellness, but essentially they're just teaching people how to eat right. Not that that's not important, but it's not necessarily comprehensive. And so teaching me to eat right doesn't manage my financial problems or my divorce that I'm going through. So there's spillage. And so I think it's very important to connect those dots, based on what those top three things are that an individual may be managing.
So there's a CEO out there, and he or she's like, uh, maybe I don't need help. I'm doing great, but my team needs help.
Mm-hmm.
So how would someone contact you? I know your website address. We're talking with Dr. Chanel Young Pope. She is the founder and CEO of Sapiente Wellness. All right. So your website address is SAPIENT wellness.com. SAPIENTE wellness.com. So somebody goes to your website, is like, okay, I'm interested. How take me through that process? What would happen? They give you a call. You guys sit.
So
How
they
does that
give me a
work?
call. I'm sorry, I
Mhm.
didn't mean to cut you
No,
off,
you're
Steve.
okay. Go ahead.
They give me a call, and basically that's I would go into my consultation role as a consultant, if you will. And so I do a consultation with the CEO, the owner of the company, to look at what hurdles they believe they're running into corporately. What is the population that they're managing? What are the top three issues they're seeing consistently? Excuse me, do you have an issue with turnover? You know, do you have an issue with just the nature of the work being overwhelmed? For example, a friend of mine is a mortician, right? And because of COVID-19, there is a substantial increase in the amount of bodies, and work that they're having to do in terms of funerals. So working with that company, in terms of grief and loss. And yes, some people may say, well, they see it every day. What's the big deal? They see it every day, but many times, some things have not resonated with them on a personal level. But now when they see, little children or, elderly people that maybe remind them of their grandmother, there are increased triggers. So going into the organization and doing sensing sessions, and then really sitting down, with corporate leadership to talk about how to more effectively manage that. But I have to know what issues they're seeing first, and then we work from there.
It's awesome. So it's Dr. Chanel Young Pope. I mean, would you say, I hate to use that word crisis, but do we have a C-suite burnout crisis in America? Do we have a top level burnout situation?
Well, there aren't any major studies. We look at burnout on smaller groups or specific populations, right? There are studies now on, the increase of burnout with tech professionals. So the studies are usually, that I have seen rather, usually targeted to a specific population. Nurses, a large population is, MDs, that a lot of the data is compiled on. And so, if to say globally, I would think there is an increase simply because of COVID. And never have we had a crisis that has happened globally on pretty much all seven continents simultaneously,
Yeah,
right?
right.
There are
Yeah.
different there are different issues happening in different regions, right? But they may not all be the same thing.
Yeah.
But with COVID, right, it's a collective experience of the same crisis globally for the most part on all continents. And so if I had to guess or speculate, I would say yes, the pandemic, there is a crisis with probably fatigue and burnout, given our first responders. The big population now is parents, having to be subject matter experts, all things education, if you will. And depending upon the educational level
Yeah.
of that parent and what type of student they were, there's spillage with that. And so to come back to the question, I would bet my life on the fact that there is a significant increase globally in terms of people reaching their breaking points, and more an increase in a crisis, people literally feeling the pinch, the crunch. But like I said, the research is not necessarily on collective groups. It's broken down on individual disciplines. But because of COVID, I'm sure that there will probably be new research, maybe around different global groups, from Americans versus those in Asia or Africa, and so on and so forth. But I do remember reading a study. It was quite some time ago. It was in Asia. I can't remember if it was China, Japan, or what have you. But they have a crisis with burnout. And one of it reminds me of what we were talking about earlier. One of the I would use the word highlighted areas of how should I say, struggle, was that they were having businessmen and women work such long hours that they were literally passing out,
Mm.
like in subways, on trains, and in various places. And as I was researching it, I can't remember the actual name of the phenomenon, but it's literally like they pass out because they've worked for maybe 10 days where they've not slept for 240 hours, if you will. And so they have photographs of men and women just literally unconscious. And it's a particular phenomenon that they mention because, but depending upon the organization they're affiliated with, it's like when we said the work is never done, they're expected to just work, work, work. And so they were talking about some of them literally pass out and they're there in like a comatose state for several hours until medical attention is provided. But some of them have literally died because they've just literally like collapsed. When we talk offline, I'll eventually tell you the name of it. But I was really like, wow, like, because I was curious, like, is this just an American thing, or like, what do people think globally about this work, 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 work kind of dynamic and its overall impact on, the physiological um, person as well as the psyche?
Well, it's great. Dr. Chanel, it's cool. We learn, your story is fantastic. Love your story. Appreciate your passion for helping people. Appreciate your authenticity of talking about, your own situation and going through it and now wanting to help others. It's really a fascinating story. And I think though my takeaway is to prioritize, right? To think about your mental health, just like I think about my physical health and working out and all that stuff, and try to be much more aware of it so that it doesn't turn into a physical problem. Catch it early, be more aware, and prioritize mental health. I think that's really good advice. Love the top three situations. Really good advice from you, and I appreciate you offering that. Again, it is Dr. Chanel Young Pope, Sapiente Wellness, and it's SAPIENTE wellness.com. You can look her up and connect with her there. And I thank you for taking your time out and for sharing your story and for giving us the advice. We've really I've consumed a lot of information here, and I've learned a lot. So thank you for that, Doc.
You are absolutely welcome. And in the meantime, if someone wants to get a hold of me, they can give me a call. My number is area code 757-572-9447. Again, I am, as you said, Dr. Chanel Young Pope, founder, CEO of Sapiente Wellness, and I consider myself a resilience professional. So I'm also coming out with a book called The Restoration Project,
Mm-hmm.
21 Days to a New You. And some of the things that we've discussed today will be in that book. Eventually, it will be showcased on the website. People will be able to go ahead and get it from Amazon. So that's coming soon. And so it was a pleasure talking to you today as well, Steve.
You too, Doc. Can you let me know when that book is ready to go? We'll let people know.
Yes, sir. I absolutely will. No problem with that.
All right. Thanks again, Dr. Chanel Young Pope. Good luck to you, and thanks for everything that you do. That wraps up this edition of Sidewalk Talk. You can download all of our podcasts by going to our website, shovelthesidewalk.com. You can also, if you have a story of inspiration, information, education, a story that we should share with others, please don't hesitate. There's a form on our website. Fill it out, and we will connect and share that story. Thanks again to Dr. Chanel Young Pope. Thank you for listening. Thanks for watching. Thank you for participating. This has been Sidewalk Talk, and I'm Steve Fortunato.